Hello, I'd like to welcome you to the Oakland County Commissioner's Corner. My name is Kathy Crawford and I am the Commissioner serving the district of Novi and the Northville portion of Oakland County. My guest today is Shane Bice, and he is with the Oakland County Health Department. And Shane, welcome to the show.
Thank you very much.
And I know you've got a lot of valuable information to share with our viewing audience here. So can you tell me, you're an administrator of what department?
Yeah. I'm the administrator of our public health nursing services, and that incorporates a lot of different services at the health division. From our nurse on call to our home visiting to our immunization services, and we even have some nurses that follow up and help assist with outbreak investigations as well.
So you're not really a nurse yourself, you're an administrator. What is your background?
Well, my background is pretty diverse to be the administrator of our nursing services. I've worked with them closely in my 12 years at the health division, but I come actually trained as an epidemiologist. Yeah.
Serious.
Which is really just keeping track of the diseases that go around in a community.
Oh,
yeah.
Okay.
And I monitor those, and we do the outbreak investigations and such.
Well, one of my favorite programs that you monitor is the Nurse on Call program.
Absolutely.
Because I think a lot of people may have a question, or maybe they think, well, my temperature is this, should I really go to the doctor? I mean, they just have simple questions and they don't want to make a doctor's appointment, or maybe they can't afford the doctor's appointment and they have a question. So I have been passing out the Nurse on Call cards.
Fantastic.
So how is that program going? I mean, how is it doing? How many people answer the phone?
That's one of our most successful programs. Our Nurse on Call service, people can call toll free, 1-800-848-5533, or if they're not inclined to speak to somebody, we do have a Nurse on Call email, and that's simply noc@oakgov.com.
NOC.
Nurse on Call, and they can simply email their question and we'll respond to them the same day. And the phone calls, they're answered. If not answered right away, they are responded to the same day as well.
So I remember when I called the number, because I like to check these things out. I called the number just to see if I would actually get to talk to a human being. So I did get to talk to a human being, but first I think I had to, you listen to a message, I think, and then I went to the Nurse on Call program and somebody actually answered. So they shouldn't be alarmed if they call and there's some, they're transferred to the Nurse on Call program.
Yep.
Is that right?
It's a pretty brief message, and they can get to the Nurse on Call pretty quick if for any reason they press 0 and get to an operator. If they ask for Nurse on Call, they'll get sent right to them. And our Nurse on Call, we have 3 nurses every day. They're bachelor prepared nurses. They have oodles and many, many years of experience in public health, and they answer topics that range everywhere from I'm sick, I have a fever, do I need to go see my doctor's office, to I just lost my job, I just lost benefits, and what services can you help connect me to that might help me get through this difficult period in my life? Or perhaps I was just diagnosed with diabetes. I don't even know what that is. Can you help me, talk to me about that and work me through some of these problems? And really, whatever it is, even if it's not necessarily health related, if they have an environmental health concern, even if that nurse can't answer the question themselves, they're wonderful where they have a nice broad overview of the rest of the health division, and they're able to get them in touch with that unit, with that person in the health division that can help answer that question.
So even if a person was going on a trip, for example, out of the country, and they were thinking about, am I going to have to get a shot, or am I going to have to get some kind of immunization? If they didn't, if they haven't gone to their doctor about it, is that something they could tell them about?
Absolutely. Even if they themselves don't have the answer, they have all the sources of information. And so an example like that, where you're getting ready to go off on the vacation of a lifetime, and you want to make sure there's going to be no illness that's going to get you sick while you're traveling abroad, if you were to call them and ask them, they'd be able to connect you with the proper information for that country from the CDC, and they would also be able to connect you with a local travel immunization clinic nearest to where that person lives to help assist them to get those vaccinations.
You know, say a person has a medication that's a very expensive medication, and maybe it's out of the formulary for their own insurance, and they want to know somewhere they could go to get that medication. Is that the kind of a call they could give them some assistance with?
That's a perfect example of the kind of call that they can get. One of the calls that we frequently get is people asking about the shingles vaccine.
Oh, yeah.
How do I get it? Where can I get it?
Because it's not available everywhere.
It's not available everywhere, no, and it's a little complicated in the way in which it gets billed for, and they can help you through that, Medicare Part D, and walk you through some of those details about that, because that's a wonderful vaccine out there for older adults, and it's not always easy to get, but they can help you find those kind of
Well, I can tell you,
products.
I mean, as the former director of the senior center, there was nothing more debilitating than shingles. It seems like when a person got shingles, it was just so horrific that I strongly encourage everyone to get the shingles vaccine. I have it, and my husband and I both went to get it. As soon as it was available, we did it. And it's a one-time thing, correct? You don't ever have to get it again. That's just the one-time thing.
Right now, it's just recommended one time in your lifetime for the shingles vaccine. Yep.
Yeah. Okay, can you recall any of the other most frequently asked questions, or did we already cover that?
We covered a lot of them, but again, there's those frequently asked questions, and then there are those that are not that frequently asked.
But could be vitally important.
But could be vitally important to you at that time. So even if you're not sure if they can help you or cover it, chances are they can. And so I would just encourage people to call and try it. And even if it's not for themselves, if they want to call on behalf of a friend, if they're a mother or a grandmother or grandfather, calling on behalf of a grandchild or a daughter or a son or something.
Oh, that's... Yeah.
You can call and you can ask for some help to at least be able to then pass that information on to that loved one of yours who you want to be able to give some referral and helpful information to.
Does your department also do anything or have any publications about over-the-counter medications? It seems like I've gotten a lot of questions because some over-the-counter medications really shouldn't be used if you're on a prescribed medication, for example, or even food, you know, that can affect certain things. Do you have any kind of publication or anything that it would help people get that information?
Nurse on Call could certainly connect you with that. We also have on staff registered dietitians that can help answer some of those questions. Again, if it's not that nurse on that Nurse on Call line, they can connect you with another knowledgeable staff in the health division to connect you to those kinds of services.
I think at one time, maybe your department did this kind of a program where you want people to get rid of their old medications because typically people just keep them. If they haven't used it all, they just hang on to it forever. And I can remember when my grandmother died that we went there and we removed medications that she'd had for 5 or 6 years in case she got that condition again. She had it there.
Right.
So eventually medications are no longer effective, right?
Yep, antibiotics, pain relief medication. After a period of time, they all start to lose effectiveness. And not only that, but there are certain medications out there, prescription only, that if you're an older adult or an adult, you don't want to have that just sitting around your house out of concern that it might get in the hands of a younger kid and not used properly. And so there are programs set out there in the county that by calling our Nurse on Call line, we can connect you to properly get those medications disposed of. So one of the most important things for antibiotics or pain relief medication is to follow that prescription from your doctor and stay in touch with them. And when you no longer need that medication, in that conversation between you and your doctor, make sure that you dispose of that medicine properly.
It seems like, and I hate to say this about the medical profession, but it seems like some doctors have such a rigid schedule. They've got so many people packed into their schedule every day that sometimes when you go to the doctor, you feel rushed and you don't really have an opportunity to ask the question, or you don't feel comfortable asking the question that you may have. I always encourage people to write down what questions they have before they get to the doctor or any concerns they have, but that might also be something they could call nurse on call about, correct?
Exactly. If it was a missing piece of their conversation with their physician and they can't get back into their physician or that medical assistant or somebody else helping out that doctor office, have them call that nurse on call line, because that might be a very simple question that they can clear up and help you out with for that day. It's a wonderful service where really whatever your issue is, whether it's a social issue where you've lost your job and you don't know where to turn to for help, or whether it's more clinical and medical where you're experiencing some signs and symptoms, they can help point you in the right direction.
Good, good. I noticed that you also are responsible for a program called Nurturing Parent Program.
Right.
And I guess, you know, some grandparents are actually taking care of their grandchildren too. So what is that program about, and would it accommodate grandparents who are taking care of grandchildren?
Yeah, our Nurturing Parent Program is a really wonderful example of the diverse programs that we have in our community nursing services. And Nurturing Parent Program is great because there's lots of parents out there, lots of grandparents out there who maybe they did not have good models as parents, and they don't know a lot of skills, parenting skills. And this
we've forgotten.
Or we've forgotten.
Yeah.
And this is a wonderful service that's a 16-week program, and it's an intensive 16-week program, and it helps them learn how to relate to that child. When that child is potty training, what are the natural stages of development for that child? As parents, if you're experiencing frustration, how does your child see that frustration in you and that relationship between you and your child? And it really helps, not just for that child, but for the rest of the family as well, to help that parent, single or married couple parent, helps them learn how to relate with that child and grow up in a nurturing environment.
So it's a class, several weeks long, right?
Several weeks long, and you also get in-depth connection with one of our many public health nurses that are specifically trained in that program.
Is there a charge for the class?
We do have financial requirements and certain criteria, but as long as you fit into that category.
So it could be like
no
a
charge.
sliding scale or something or other. And you would have to go to Pontiac to have the class?
That can be held sometimes in-house, sometimes there are group meetings, but for the class itself, there is no charge. It just depends upon your financial situations and some other social criteria.
Okay. I know a number of people that either have had a visiting nurse or they need a visiting nurse. How does that program work now? I mean, I'm sure it's changed over time.
Yeah, the VNA, Visiting Nurse Association, has a little different service and focus than our public health nursing services. Our public health nurses that go out into the community, our main focus is to help prevent infant mortality within Oakland County. And what that is that's when an infant dies before 1 year of age. And that can be a result of simply prematurity, having a healthy pregnancy. And so our very highly skilled nurses that go out there and help those mothers, they help them have a healthy pregnancy. And they help them with support services after they have that childbirth.
So how does a person get that? I mean, are they referred by the hospital, for example, to you need to have this public health nurse come to your home, or how does that work?
And that's one of the wonderful aspects of this program, not just Nurturing Parent Program, not just our Nurse Family Partnership Program or our regular public health nurses that go out into the community with it, but you don't need a physician referral. You don't need any kind of official paperwork like that. All they have to do is call our nurse on call at 1-800-848-5533 to call and ask for help. And that way they can get hooked up with one of our public health nurses for those support services.
So if they were trying to nurse, for example, nurse their infant and it wasn't working out, they could call and someone could come out and help them or show them or whatever.
Exactly.
Right?
Whether it's one of our public health nurses or one of our dietitians or nutritionists, we have some experts in helping women breastfeed successfully, because now it's recommended that you
Yeah.
breastfeed as long as you can, up to 1 year of age, and even longer if possible. And really, the benefits of breastfeeding just go above and beyond, from protecting that very young infant from infection from the mother's natural immunity, all the way up to helping prevent infant mortality and incidence of sudden unexpected infant death syndrome. And it's been shown to be a protective factor. And it's not easy. My wife, she breastfed all 3 of our children, and she had to work at it. And so when you need help, we have staff there to help that mother do that.
Great. And back to the visiting nurses now. If a person, people are being released from hospitals really very quickly now, and you have to participate in your own care.
Mm-hmm.
I've been sent home with drainage tubes and things, and I'm thinking, how can this be? I don't know what to do. You don't even ask the questions while you're at the hospital, and they
Right.
rattle off all this information. Do you understand? Typically, you nod your head, yeah, I understand. And then you get home and you go, I have no idea where to start or what to do.
Mm-hmm.
So, is visiting nurse a person that could come out in that case? If a person is coming home from the hospital, or how does the visiting nurse work?
Well, how our community public health nurses work, most of our clients are those mothers or those infants, but in certain circumstances, depending upon the situations, we might assist that adult in needs of those services. Or more commonly, if that older adult, whoever, if they get home and they're confused and they're trying to look through this paperwork, this mound of discharge planning that they have, and they just don't know where to start, especially if they were just in a hospital and they don't have insurance and they don't know where to turn for other assistance. Our Nurse on Call service can help digest that information and get them in touch with the right kind of agencies and services that can help them, even if they don't have the financial ability to pay for them sometimes.
Great. Now, is visiting nurse and community health nurse now one and the same? They're called community health nurse. What?
Yeah.
That?
We have our public health nurses they're a wonderful, diverse group, and they do so many different things. And they go out, and most of their day is spent in the home visiting those mothers-to-be, those brand new mothers for the first time. And so that's their main focus. Whereas the Visiting Nurse Association, which is a wonderful organization that...
And that's part of the health department as well?
That
actually
is separate from the health, from the health division. But we are wonderful in that we both have our own special focus areas where...
Okay, and you would refer people back and forth, whatever they
Absolutely.
Would need, right?
That's the wonderful thing about the Nurse on Call. They know those agencies. They know those people, and those people, as much as we can, we want to get them to know our Nurse on Call. We want to get them to know us, so that when they have a client where we can really help them, we want to know that they can send them our way.
Would the Nurse on Call also be able to help people? Many times I have been called by a discharge planner from a hospital saying, do you have resources? I have a person that's going to be leaving the hospital tomorrow, and they don't have any family around, and they're going to need some services. Would they have information about Meals on Wheels, for example, or other things if a person needed it?
Absolutely. And I'm going to take the scenario one extra step. What if that person doesn't have a home? What if that person is about to get evicted from their home? We have a wonderful partnership. It's called the Homeless Healthcare Collaboration, and it's really been spearheaded by one of our public health nurses with our support from our health educators as well. And we've really formed this collaborative group with healthcare providers, hospitals and nurses and doctors, and also community agencies that help support the homeless. And what we're doing right now is really, it's wonderful that we're getting to know each other, and we've been together with so many meetings, and we're getting to know each other, and we turn to each other and we're like, I didn't know you did that. I didn't know you did that.
Yeah, it's all that coordination.
And it's a coordination of services, and now that we're getting to know those fellow community agencies, we're able to help those people, whether or not they're homeless or whether or not they're just, they don't have any support services. We can help find them those agencies that can.
One thing I noticed too is that you do have speakers that actually will go out to organizations or maybe schools or libraries or whatever on a variety of topics. How would they find out what kind of topics you had a speaker for?
Yep, absolutely. On our webpage at oakgov.com/health, we have a button right there on our front page for Public Health Speakers Team with a whole list of all the various topics that we have a variety of expertly trained staff able to go out there and give a presentation to. This is no charge, and it's really just a matter of setting up and getting a proper schedule in place, and we'll come out there and we'll give the best education to your group that we can.
I think in most, well, I guess in most areas, it seems like the biggest problem is a lack of communication and a lack of information for people. And there's a variety of resources, like you said, that are like these separate little silos, and sometimes they don't speak to each other. But now all of that is changing. So people really need to get the information, and the Speakers Bureau is a great way. You know, and I'm sure you have a lot of topics, right?
We have environmental health sanitarians that can come out and talk about food safety, can talk about water safety. We have health educators that can come out and talk to you about how to properly get an infant into a car seat. I know I'm a fairly new father, and I still sometimes struggle with that.
Me too, as a grandparent.
Yep.
Yeah, it's hard.
We have nurses that can come out, talk to you about proper hand washing, about proper infant care, proper safe sleep practices to help prevent infant mortality in Oakland County. And so we have all these wonderful, diverse people who are trained to go out there and speak and deliver that message to that group in an easy to understand way. So you're not talking over everybody's
I want to talk for a moment too about the flu vaccine, and also one thing that I'm really concerned with is whooping cough, or pertussis, I believe is what it's called. Because I was vaccinated when I was young, and you know, my sisters all were too. But I have a niece that just had a baby, and I heard somebody from the health department say, you know, people need to get re-vaccinated. Is that true? I mean,
It is, and the pertussis vaccine, while it's wonderful and it protects the youngest infants and the children when they're most vulnerable, it does wane. The effectiveness of the vaccine does decrease over time.
So as a grandparent, we should get a booster or something or other if we're gonna, before we go near infants, is that correct?
I absolutely support that, and you do need to do that. And the whole idea is that grandparents, parents, and really anybody else, if you're a babysitter, even if you're 18 or somebody and you're babysitting a newborn infant, it's important to get that Tdap vaccination to form a cocoon of protection around that child.
Because the infant really doesn't have, you know, in the beginning, they don't have the shots or anything yet. They don't get them till later, correct?
Yep, they won't be fully vaccinated until they can get up to the years of 4 to 6 years of age against pertussis, and so it's important that those around them get that vaccination. And it's actually now recommended that for pregnant mothers, for every pregnancy, that they receive a pertussis booster dose.
Oh, really? Oh, wow.
Yeah.
And that's a horrible disease, that whooping cough, too. From what I understand, it's very dangerous for infants.
Yeah, and one of the most insidious things about the disease is you and me as adults, we might not get that sick. We might have a cough that lasts for a few weeks, and we might not think anything of it. But it's that infant that, if we're not protected and we spread it to them, who can really experience that whooping cough where they're not able to breathe and they're not able to get air into their lungs, and it can unfortunately potentially lead to death.
Well, quickly too, I want to cover the flu shot, because everybody's giving flu shots. It seems like, you know, the drugstores and the banks even. I mean, I don't know where all you can get a flu shot now, which is good, but then maybe it's not the kind of flu shot they should get. And I know the health department gives a flu shot. What do people need to do, and how much does it cost?
Well, this year, the flu vaccine, there's a couple different kinds. There's the 3-dose, and then there's the 4-dose, the 4-strain flu shot. And it has one extra strain, one extra kind of influenza that it protects against. And the health division,
like a bonus, right?
It's exactly, it's a bonus flu protection. And at the health division, almost all of our vaccine stock that we have is the 4-dose the 4-strain flu shot protection that provides against. It's still just one shot. Or it's not always a shot. You can still get, for those who are between the ages of 2 and 49, You can get a vaccine of a little bit of a mist up the nose if you don't like to get flu shots.
Who likes shots? I've never heard anybody say they like a shot. So,
Exactly.
I can't believe they would.
And wherever you can get that flu vaccine, the CDC recommends that you go out there and get, because again, it's one of those wonderful things that we can help protect against, that even if we ourselves, we don't want to get it, or we don't think we want to get the vaccine, there are some out there who can't get vaccinations. And by you yourself getting protected, you're not just protecting yourself, you're protecting some of those people out there who might not be able to get it themselves.
I know, for a long period of time I thought, well, I never get the flu, so why should I get the shot? And I think there's some misconceptions too about the flu. You know, like my daughter doesn't like for her kids to have any kind of shots, because she thinks it's dangerous. You know, she's somehow or other she has it in her head that kids shouldn't have a lot of these medications and shots. But what are some of the other misconceptions about that?
A lot of the misconceptions out there is that, well, I got the flu shot and I got the flu, I got sick. And oftentimes it's not the flu that you got. And maybe it was a head cold and you thought was influenza, or it might have been this other disease out there called the stomach flu, called norovirus, and a lot of people think that might be influenza. So the flu shot or the flu vaccine, if you get the mist intranasally, that can help protect against influenza. And we have that at our health division for $20, no insurance needed, and we're available 8:30 to 5 p.m. Tuesday through Friday, and noon to 8 on Mondays.
So they'd have to go to Pontiac, or they could go to Southfield.
We have two offices in Pontiac and Southfield. In Southfield, we're at the corner of Greenfield and Catalpa. And in Pontiac, we're on our campus with our other county services, and they both have the same hours.
Well, Shane, you know, I know we could talk a lot about other kind of programs and everything. There's so many things available by the county. It's such a wonderful resource. Is there anything that you would like to encourage people to do, you know, in closing?
I would just really like to encourage people, if they don't know much about the health division, or if they heard us talk about anything they'd like to know more about, go to our website, again at oakgov.com/health, and we have a wonderful website that's easy to navigate, that has fact sheets about diseases, that has information on our public health speakers team, that has information on some of the other programs that we talked about today. And if they don't have a connection to the internet, but they have a telephone, have them call that Nurse On Call line.
Or they could even go to the Novi library and use one of those computers there and perhaps get in touch with you. So even if they don't have the ability to use the computer at home, somebody could help them even at the library to navigate that and
get
find
them to
out
our
more
site.
about it. So I appreciate you coming today and being our guest. I think that you had a lot of great information, but I know we barely skimmed the surface. So hopefully you can come back again and tell us what the latest and greatest things are at the health department. So thank you once again for coming. Really appreciate that. And I want to thank you, the viewing audience, for tuning in, and I hope you come back and join me again at the Commissioner's Corner, because we got some more really great shows coming up. So thanks for viewing.